Hello and welcome to MedSpirit. Thank you for choosing this guide. End of Cramps, a complete guide to managing menstrual pain. Whether you're listening to find relief, support a loved one, or simply understand your body better, you're in the right place. This is not just a book, it's a healing companion. One filled with practical advice, empowering knowledge, and hope. So take a moment, settle in, and let's walk together through the path to comfort, clarity, and control over menstrual pain. Let's begin. Introduction. Pain is not normal. It is the body's way of asking for help. Unknown. For as long as women have experienced menstruation, they have also endured menstrual pain. It is so common that many have come to believe it is just a natural part of life, something to be tolerated in silence, a monthly burden to bear. But should it really be this way? Should women be expected to suffer through excruciating cramps, nausea, fatigue, and headaches simply because society has normalized period pain? For some, menstrual discomfort is mild and manageable. For others, it can be debilitating, interfering with work, relationships, and daily activities. The worst part? Many women do not fully understand why they experience such intense pain, and even fewer know what they can do about it. Some doctors often brush off period pain as normal, prescribing painkillers without investigating the root cause. Meanwhile, myths and misinformation about menstruation continue to spread, making it even harder for women to find real solutions. This book is here to change that. Menstrual pain is not just an inconvenience, it is a signal from the body that something is happening internally. Understanding why periods hurt, what factors contribute to severe cramps, and how to manage them effectively can empower women to take control of their health. From the role of hormones to the impact of diet, lifestyle, and stress, we will explain what truly causes menstrual pain and why some women experience more severe symptoms than others. This is not just about temporary relief, it is about long-term solutions. Whether through natural remedies, medical treatments, or lifestyle adjustments, every woman deserves to know her options. More importantly, she deserves to know that menstrual pain is not something she has to simply endure. If you have ever wondered why your periods are so painful, why some months feel worse than others, or why traditional treatments don't seem to work for you, this book is for you. It is time to break the silence, challenge the misconceptions, and start listening to what our bodies are trying to tell us. Pain is not a punishment, it is a message, and together we will learn how to respond to it in the best possible way. Chapter 1. Understanding menstrual pain. Pain is the body's way of speaking. The question is, are we listening? For many women, menstrual pain is just another part of life, an unwelcome but expected visitor every month. Some pop a painkiller and push through the discomfort, while others find themselves curled up in bed, unable to function. The experience of period pain is so common that many don't stop to question why it happens, or if it could be prevented. But understanding what causes menstrual pain is the first step to finding real relief. At its core, period pain happens because the muscles of the uterus contract to shed its lining. These contractions are triggered by hormone-like chemicals called prostaglandins, which help the uterus do its job efficiently. When prostaglandin levels are balanced, the contractions are mild and barely noticeable. But when these levels are too high, the contractions become stronger and more painful, cutting off blood supply to the uterine tissue and causing cramping. This explains why some women experience only mild discomfort, while others feel intense pain that radiates through their lower abdomen, lower back, and even down their legs. For some, menstrual pain is simply a natural part of the cycle, something that starts in adolescence and remains fairly consistent over the years. But for others, it can become worse with age or appear suddenly after years of relatively pain-free periods. This can happen due to hormonal shifts, increased stress, or underlying conditions like endometriosis, fibroids, or adenomyosis. In these cases, the pain isn't just about the uterus shedding its lining, it's a sign of something deeper that needs attention. The intensity of period pain also varies depending on lifestyle and health. Poor circulation, lack of physical activity, high stress levels, and an unhealthy diet can all make cramps worse. Some women notice that their pain fluctuates depending on how well they have been taking care of their body in the weeks leading up to their period. Others find that their pain is consistent and unchanging, no matter what they do. In both cases, the key to managing period pain lies in identifying the root cause, rather than just masking the symptoms with painkillers. There is also a significant difference between normal menstrual cramps and pain that signals a medical condition. Mild to moderate cramping that lasts for a couple of days and improves with heat or over-the-counter medication is usually considered normal. But pain that is severe, long-lasting, or accompanied by other symptoms like heavy bleeding, nausea, or painful intercourse may indicate an underlying issue. Many women go years without realizing that their pain is abnormal because they have been conditioned to believe that suffering through it is just part of being a woman. Despite how common menstrual pain is, it is often misunderstood or dismissed. Women are frequently told that it's all in their head, that it's just something they have to live with, or that having a painful period is a sign of being strong. But the reality is that no one should have to suffer through intense pain every month without answers or solutions. Understanding why menstrual pain happens is the first step toward finding relief, and in the next chapter, we will explain the most effective ways to manage and prevent it, both naturally and medically. Chapter 2. Why some periods hurt more than others. Every woman's cycle is different, but pain shouldn't be the price we pay for being women. Not all periods are the same, and not all pain feels the same. Some women barely notice their periods, while others count down the days, dreading the pain that comes with it. But why does it hurt more for some than others? The answer lies in a combination of hormones, lifestyle, and overall health. The main cause of period pain is a chemical in the body called prostaglandin. This substance helps the uterus contract to shed its lining, but too much of it can make the 8 contractions strong and painful. If the uterus squeezes too hard, it can temporarily cut off blood flow, leading to a sharp, cramping pain. Women with higher levels of prostaglandins tend to have more severe cramps. For some, period pain is a simple case, inherited through family genes. If your mother or sister has painful periods, chances are you might experience the same. But genetics isn't the only factor. Lifestyle also plays a huge role. High levels of stress, poor diet, lack of exercise, and even too much caffeine or alcohol can all make period pain worse. Underlying health conditions can also make periods more painful. Endometriosis, for example, happens when tissue similar to the lining of the uterus grows outside of it, causing extreme pain. Fibroids, non-cancerous growths in the uterus, can also make cramps worse. Adenomyosis, a condition where the uterine lining grows into the muscle of the uterus, leads to intense, long-lasting pain. These conditions often go undiagnosed for years because many women assume that severe pain is normal. Age can also influence period pain. Teenagers and young women often have stronger cramps because their bodies are still adjusting to regular cycles. As they get older, the pain may lessen. However, for some women, periods become more painful with age, especially as they approach their 30s and 40s due to hormonal changes or medical conditions that develop over time. Another reason some women experience worse period pain is related to their overall health. A weak immune system, poor blood circulation, and chronic inflammation in the body can all make cramps more intense. Smoking, an unhealthy diet, and high levels of stress can contribute to this, making each period feel worse than the last. Even though period pain is common, it shouldn't be ignored, especially if it's severe or interfering with daily life. Many women suffer in silence, thinking it's just part of being a woman, but that's not true. There are real reasons why some periods hurt more than others, and understanding them is the first step toward finding relief. In the next chapter, we will explain natural ways to ease menstrual pain and make periods more manageable without relying too much on medication. Chapter 3. Natural ways to relieve period pain. Your body speaks to you every month. Learning to listen can help ease the pain. For many women, period pain feels like an unavoidable part of life. The cramping, aching, and discomfort can be exhausting, often making even simple tasks feel impossible. While painkillers can help, they are not the only option. There are natural and effective ways to relieve menstrual pain without relying on medication. Heat is one of the oldest and simplest remedies for period cramps. A warm heating pad or a hot water bottle placed on the lower abdomen helps relax the muscles and improve blood flow, reducing pain. Studies have shown that heat therapy can be just as effective as painkillers like ibuprofen in relieving cramps. Taking a warm bath can also provide similar relief, easing muscle tension and promoting relaxation. Movement may be the last thing on your mind when you're in pain, but gentle exercise can actually help. Activities like walking, stretching, or yoga encourage better circulation and release endorphins, natural painkillers that improve mood and reduce discomfort. Even light movements, like pelvic tilts or slow deep breathing, can make a difference. What you eat before and during your period can also influence how much pain you experience. A diet high in processed foods, sugar, and caffeine can lead to inflammation, which can make cramps worse. On the other hand, eating foods rich in magnesium, omega-3 fatty acids, and antioxidants can help ease the pain. Leafy greens, nuts, seeds, fish, and berries are great choices. Drinking herbal teas, such as ginger or chamomile, can also help relax the muscles and reduce inflammation. Staying hydrated is just as important. Dehydration can cause bloating and worsen cramps, making the pain feel more intense. Drinking enough water throughout the day, as well as herbal teas or warm lemon water, can help reduce bloating and ease discomfort. Managing stress is another key factor. High stress levels can make period pain worse by increasing muscle tension and inflammation in the body. Meditation, deep breathing exercises, or simply taking time to rest can help the body feel more at ease. Practices like acupuncture and massage therapy have also been found to reduce menstrual pain by improving circulation and balancing hormones. Sleep plays a crucial role in pain management. Poor sleep can increase sensitivity to pain, making cramps feel worse. Creating a sleep routine like going to bed at the same time every night, avoiding screens before bed, and keeping the room cool and dark can help improve the quality of rest and make periods more manageable. Many women turn to natural remedies like essential oils for relief. Massaging the lower abdomen with diluted lavender or peppermint oil can help relax the muscles and reduce discomfort. Similarly, castor oil packs applied to the abdomen have been used for centuries to relieve cramps and promote better circulation. While these natural methods can be very effective, every woman's body is different. It may take some time to find what works best for you. In the next chapter, we will look at the role of hormones in menstrual pain and why understanding your cycle can help you manage discomfort more effectively. Chapter 4. The role of hormones in menstrual pain. Hormones are like an orchestra. When they are in balance, everything flows smoothly. When they are not, pain takes the lead. Menstrual pain is not just about the uterus contracting. Hormones play a crucial role in how much discomfort a woman experiences during her period. The rise and fall of specific hormones throughout the menstrual cycle influence everything from mood to energy levels, and, most importantly, the intensity of menstrual cramps. One of the key players in period pain is prostaglandins. These hormone-like compounds help the uterus contract to shed its lining during menstruation. However, when prostaglandin levels are too high, the contractions become stronger and more painful. This is why some women experience mild discomfort, while others feel severe cramping that can make them nauseous or lightheaded. Prostaglandins also cause inflammation, which can contribute to bloating, headaches, and digestive issues that often accompany periods. Estrogen, another important hormone, affects the menstrual cycle in multiple ways. When estrogen levels are in balance, the body maintains a smooth cycle with manageable symptoms. However, if estrogen is too high or too low, it can contribute to painful periods. High estrogen levels can lead to heavier bleeding and stronger cramps, while low estrogen can make periods irregular and more uncomfortable. This hormonal imbalance can be influenced by diet, stress, environmental toxins, and lifestyle choices. Progesterone works alongside estrogen to regulate the menstrual cycle. In the second half of the cycle, progesterone levels rise to prepare the body for a possible pregnancy. If pregnancy doesn't occur, progesterone drops, triggering menstruation. When progesterone levels are too low, it can lead to increased prostaglandin production, which makes cramps worse. Women with low progesterone may also experience more severe premenstrual symptoms like anxiety, mood swings, and trouble sleeping. Cortisol, the stress hormone, can also impact period pain. Chronic stress increases cortisol levels, which can throw off the balance of reproductive hormones. High cortisol levels can make cramps feel more intense and contribute to irregular cycles. This is why women who experience high levels of stress often report worsened period symptoms or even skipped periods altogether. Hormonal birth control is often used to help regulate period pain. Birth control pills, patches, and hormonal intrauterine devices, IUDs, can lower prostaglandin levels and make periods lighter and less painful. However, not all women respond the same way to hormonal contraceptives, and some may experience side effects like headaches, mood changes, or breakthrough bleeding. Balancing hormones naturally is possible through diet, exercise, and stress management. Eating nutrient-dense foods, avoiding processed sugars and excess caffeine, getting enough sleep, and engaging in regular physical activity all contribute to hormonal balance. Certain herbs, like chasteberry and maca root, have been traditionally used to support reproductive health and may help regulate hormonal fluctuations. Understanding the role of hormones in menstrual pain can empower women to take control of their cycles. By recognizing the signs of hormonal imbalances and making lifestyle adjustments, it is possible to reduce period pain and improve overall well-being. In the next chapter, we will explain the connection between diet and menstrual pain, highlighting foods that can either worsen or relieve discomfort. Chapter 5. The link between diet and menstrual pain. Food is not just fuel, it is medicine. The right choices can ease your pain, while the wrong ones can make it worse. What you eat plays a significant role in how your body responds to menstruation. Some foods help reduce inflammation and support hormonal balance, while others trigger bloating, cramps, and mood swings. Many women don't realize that their diet may be making their period symptoms worse, and small dietary changes can often lead to noticeable relief. Inflammation is a major cause of menstrual pain, and certain foods either increase or decrease inflammation in the body. Processed foods high in refined sugar, artificial additives, and unhealthy fats can contribute to chronic inflammation, leading to more severe cramps. Eating too much salty food can cause bloating, while excess caffeine and alcohol can disrupt hormonal balance and dehydrate the body, making cramps more intense. On the other hand, an anti-inflammatory diet can help reduce pain and discomfort. Omega-3 fatty acids, found in fatty fish like salmon and in seeds like flax seeds and chia seeds, have been shown to reduce prostaglandin levels, which helps relax uterine muscles and lessen cramping. Leafy greens like spinach and kale provide magnesium, a mineral that helps relax muscles and reduce tension. Nuts, avocados, and olive oil provide healthy fats that help keep hormones in balance. Cruciferous vegetables like broccoli, cauliflower, and Brussels sprouts are rich in compounds that support estrogen metabolism. Since excess estrogen can contribute to painful periods, eating these vegetables helps the body maintain a healthy hormonal balance. Fiber-rich foods, such as whole grains, beans, and fruits, support digestion and help the body eliminate excess hormones that may contribute to menstrual pain. Hydration is also essential. Drinking enough water prevents bloating and helps maintain smooth muscle function in the uterus. Herbal teas, such as ginger and chamomile, have natural anti-inflammatory and pain-relieving properties. Ginger has been found to reduce the severity of menstrual cramps, while chamomile can help relax the nervous system and ease tension. Some women find relief by reducing dairy and gluten intake. While not everyone is sensitive to these foods, some studies suggest that dairy can increase inflammation in the body, and gluten may contribute to hormonal imbalances in certain individuals. Keeping a food diary and tracking symptoms can help identify any dietary triggers. Making mindful food choices doesn't mean you have to give up everything you love. The key is balance. By minimizing processed and inflammatory foods while increasing nutrient-rich, whole foods, you can naturally support your body during menstruation. Small adjustments to your diet can make a significant difference in how you feel each month. In the next chapter, we will discuss how lifestyle habits such as exercise, sleep, and stress management influence menstrual pain and overall cycle health. Chapter 6. Lifestyle habits that affect menstrual pain. Your daily habits shape your health more than you realize. Small changes in routine can lead to big changes in how you feel. Menstrual pain is not just about hormones, it is also influenced by how you live your daily life. The choices you make regarding exercise, sleep, stress management, and overall self-care can either worsen period pain or help ease it. Many women don't realize that certain habits are making their cramps more severe, while small adjustments can lead to significant relief. Exercise is one of the most underrated ways to manage menstrual pain. When you move your body, it increases blood circulation, reduces inflammation, and releases endorphins, your body's natural painkillers. While high-intensity workouts may feel difficult during your period, gentle activities like yoga, stretching, walking, and light strength training can help relieve cramps and improve mood. Yoga poses, in particular, have been shown to reduce pain by stretching the lower abdomen and relaxing the muscles in the pelvic area. Sleep is another critical factor in managing menstrual discomfort. Poor sleep increases stress hormones and inflammation in the body, which can make period pain worse. Many women experience trouble sleeping before or during their period due to hormonal fluctuations. Creating a sleep-friendly environment, sticking to a consistent sleep schedule, and avoiding stimulants like caffeine before bed can improve sleep quality. Practicing relaxation techniques such as deep breathing or meditation before bed can also help regulate the nervous system and reduce period-related discomfort. Stress plays a major role in menstrual health. When you're under chronic stress, your body produces more cortisol, which can interfere with reproductive hormones and make period symptoms more intense. Many women notice that stress can lead to irregular cycles, heavier bleeding, or more painful cramps. Finding ways to manage stress, whether through meditation, deep breathing exercises, journaling, or engaging in hobbies, can make a difference in how your body responds to menstruation. Posture and movement throughout the day also matter. Sitting for long hours, especially in a hunched position, can increase tension in the lower back and pelvic area, worsening cramps. Taking breaks to stretch, practicing good posture, and incorporating gentle movements throughout the day can prevent muscle stiffness and improve blood flow to the lower abdomen. Hydration is another simple but important habit. Dehydration can make cramps worse by causing muscles to tighten. Drinking plenty of water helps prevent bloating, reduces water retention, and keeps the body functioning properly. Herbal teas such as peppermint, ginger, and chamomile can also have soothing effects on the uterus and digestive system. Caffeine and alcohol consumption can also affect menstrual pain. While a cup of coffee may seem harmless, too much caffeine can constrict blood vessels and lead to more painful cramps. Alcohol, on the other hand, can dehydrate the body and increase inflammation, making symptoms worse. Cutting back on caffeine and alcohol, especially in the days leading up to your period, can help reduce discomfort. By making small but consistent lifestyle changes, you can support your body's natural cycle and reduce menstrual pain over time. Exercise, good sleep, stress management, hydration, and movement all work together to create a healthier, more balanced system. The key is finding what works best for your body and making adjustments that fit into your lifestyle. In the next chapter, we will explore the role of hormonal imbalances in menstrual pain and how to identify and address them naturally. Chapter 7. Hormonal imbalances and menstrual pain. When hormones are in balance, the body works like a well-tuned machine. When they're out of sync, they can create chaos. Hormones are the body's chemical messengers, regulating everything from mood and metabolism to sleep and reproductive health. When they are in balance, the menstrual cycle runs smoothly. But when they are out of sync, they can cause a range of issues, including severe menstrual pain. Many women don't realize that their cramps, mood swings, and irregular cycles may be a sign of hormonal imbalances rather than just a normal part of having a period. Estrogen and progesterone are the two primary hormones that control the menstrual cycle. Estrogen helps build up the uterine lining before ovulation, while progesterone maintains that lining in preparation for pregnancy. If pregnancy does not occur, progesterone levels drop, triggering menstruation. When these hormones are imbalanced, they can lead to painful and irregular periods. Too much estrogen, a condition known as estrogen dominance, can cause heavier periods, bloating, breast tenderness, and severe cramps. Low progesterone, on the other hand, can lead to mood swings, anxiety, and disrupted cycles. Another key player is prostaglandins, hormone-like substances that help the uterus contract during menstruation. While some prostaglandins are necessary for shedding the uterine lining, excessive levels can cause intense cramps, nausea, diarrhea, and headaches. High prostaglandin levels are often linked to conditions like endometriosis and heavy periods. Polycystic ovary syndrome, PCOS, is one of the most common hormonal disorders affecting menstruation. It occurs when the ovaries produce excess androgens, male hormones, leading to irregular periods, severe cramps, acne, and hair growth in unexpected places. Women with PCOS often have difficulty ovulating regularly, which can make their menstrual cycles unpredictable and painful. Thyroid disorders can also affect menstrual health. The thyroid gland regulates metabolism and energy levels, but when it's not functioning properly, it can lead to menstrual irregularities. An underactive thyroid, hypothyroidism, can cause heavy, prolonged periods and fatigue, while an overactive thyroid, hyperthyroidism, may lead to lighter or skipped periods. Lifestyle factors play a significant role in hormonal balance. Chronic stress, lack of sleep, poor diet, and exposure to endocrine-disrupting chemicals found in plastics, beauty products, and processed foods can throw hormones off balance. Managing stress, getting enough rest, and avoiding processed foods high in sugar and unhealthy fats can support a more stable hormonal environment. There are natural ways to help restore hormonal balance and reduce menstrual pain. Eating a nutrient-rich diet with plenty of fiber, healthy fats, and protein can help regulate estrogen and progesterone levels. Certain herbs like chasteberry, vitex, have been used for centuries to support hormone balance and reduce PMS symptoms. Regular physical activity, particularly strength training and yoga, can help stabilize hormone levels and improve circulation. Understanding your hormones and how they impact menstrual pain is an important step in managing period discomfort. Instead of simply accepting painful periods as normal, identifying underlying imbalances can help you take targeted steps toward relief. In the next chapter, we will talk about how diet and nutrition play a role in menstrual health and how food choices can either worsen or alleviate pain. Chapter 8. Food, Nutrition, and Menstrual Pain. Let food be thy medicine and medicine be thy food. Hippocrates. What you eat plays a significant role in how your body functions, and menstrual health is no exception. While many women experience cravings during their periods, often for sugary, salty, or fatty foods, certain dietary choices can either worsen or alleviate menstrual pain. The connection between nutrition and menstrual health is often overlooked, yet food can be one of the most powerful tools for managing cramps, bloating, fatigue, and mood swings. Inflammation is a major contributor to menstrual pain, and diet has a direct impact on inflammation levels in the body. Processed foods high in refined sugars, unhealthy fats, and additives can increase inflammation and worsen cramps. Excessive caffeine and alcohol consumption can also disrupt hormonal balance, leading to more severe symptoms. On the other hand, a diet rich in anti-inflammatory foods, such as fruits, vegetables, whole grains, and healthy fats, can help reduce period pain and promote hormonal stability. Omega-3 fatty acids, found in foods like salmon, flax seeds, walnuts, and chia seeds, have been shown to reduce inflammation and ease menstrual cramps. These healthy fats work by lowering the levels of prostaglandins, compounds that trigger uterine contractions. Magnesium is another essential nutrient for menstrual health, as it helps relax the muscles of the uterus, reducing cramps. Foods high in magnesium include dark leafy greens, nuts, seeds, and whole grains. Iron levels can also take a hit during menstruation, especially for women with heavy periods. Low iron can lead to fatigue, dizziness, and weakness. Consuming iron-rich foods such as spinach, lentils, red meat, and fortified cereals can help replenish lost iron and prevent anemia. Pairing iron-rich foods with vitamin C sources like citrus fruits and bell peppers enhances iron absorption. Hydration is another crucial factor. Dehydration can lead to bloating and water retention, making cramps feel worse. Drinking plenty of water and herbal teas can help flush out excess sodium and reduce bloating. Ginger and chamomile teas, in particular, have been used for centuries to soothe menstrual discomfort. Many women find relief by limiting dairy and processed foods, as these can contribute to hormonal imbalances and inflammation. While dairy is a good source of calcium, some women are sensitive to it, leading to increased bloating and cramps. Alternatives like almond milk, tofu, and leafy greens can provide calcium without the added inflammation. For those who struggle with severe PMS symptoms, balancing blood sugar levels is key. Skipping meals or consuming too many refined carbohydrates can cause blood sugar spikes and crashes, leading to mood swings, irritability, and cravings. Eating balanced meals with a combination of protein, healthy fats, and fiber can help keep blood sugar levels stable throughout the menstrual cycle. Herbal remedies have long been used to support menstrual health. Turmeric, with its active compound curcumin, has anti-inflammatory properties that can help reduce period pain. Cinnamon has also been found to ease cramps and improve circulation. Rather than relying on painkillers alone, making simple dietary changes can significantly impact how you feel during your period. By choosing nutrient-dense, anti-inflammatory foods, you can support your body's natural cycle and reduce the severity of menstrual pain. In the next chapter, we will look at the role of physical activity and movement in managing menstrual pain, and how certain exercises can help ease discomfort and improve overall well-being. Chapter 9. Movement and exercise for menstrual pain relief. Take care of your body. It's the only place you have to live. Jim Rohn. When menstrual cramps strike, the last thing many women want to do is move. The instinct is to curl up, rest, and wait for the pain to pass. While rest is important, movement can be one of the most effective natural ways to relieve period pain. Exercise increases blood flow, reduces stress, and releases endorphins, your body's natural painkillers. Instead of making you feel more exhausted, gentle movement can actually help your body relax, easing cramps and discomfort. The idea of exercising while in pain may seem counterintuitive, but studies have shown that physical activity helps reduce period symptoms. One of the main reasons is the effect of movement on circulation. When you exercise, blood flow increases throughout your body, including to the pelvic region, helping to reduce the intensity of cramps. It also helps oxygenate muscles, preventing the tightening and spasms that cause pain. Low-impact exercises such as walking, yoga, and stretching are particularly effective for menstrual pain. Walking is a simple and gentle way to keep your body moving without overexerting yourself. Even a short, slow-paced walk can help loosen up tight muscles and improve circulation. Yoga, on the other hand, combines movement with deep breathing, making it especially beneficial for menstrual pain relief. Certain poses, such as child's pose, cobra pose, and seated forward bends, help relax the lower abdomen and relieve tension in the lower back. Stretching exercises can also help relieve menstrual discomfort. Simple stretches that target the lower back, hips, and abdominal muscles can reduce tightness and improve flexibility. Many women experience lower back pain during their periods due to the way the uterus contracts, and gentle stretching can provide significant relief. For those who prefer more structured exercise, swimming and cycling can be excellent options. Swimming, in particular, is beneficial because the buoyancy of water reduces pressure on the body, allowing for gentle movement without strain. Cycling, whether outdoors or on a stationary bike, can improve circulation and boost energy levels. Another powerful tool for period pain relief is deep breathing and relaxation techniques. When the body is tense, it can make cramps feel worse. Practicing deep breathing exercises, meditation, or progressive muscle relaxation can help release tension and reduce stress. Stress and anxiety can heighten pain sensitivity, so incorporating mindfulness practices can make a big difference in how the body perceives discomfort. It's important to listen to your body and choose activities that feel good. On some days, a light walk or gentle stretching may be all you need, while on others, a yoga session or a slow bike ride might feel more beneficial. The key is to stay consistent. Regular movement throughout the month, not just during your period, helps regulate hormones, improve circulation, and strengthen the body's ability to handle menstrual pain more effectively. Many women find that the more they incorporate movement into their routine, the less severe their period symptoms become over time. Exercise doesn't have to be intense to be effective. The goal is not to push through the pain, but to work with your body, helping it function more smoothly. In the next chapter, we will discuss the connection between stress, mental health, and menstrual pain, and how emotional well-being plays a crucial role in how the body experiences pain. Chapter 10. The role of stress and mental health in menstrual pain. You don't have to control your thoughts, you just have to stop letting them control you. Dan Millman. Stress is an unavoidable part of life, but when it comes to menstrual pain, stress can make things much worse. Many women notice that their cramps, bloating, and fatigue are far more intense during months when they feel particularly anxious, overwhelmed, or emotionally drained. While menstrual pain is largely caused by physical processes like uterine contractions and hormonal shifts, mental and 38 emotional well-being also play a crucial role in how pain is experienced. The link between stress and menstrual pain lies in the body's response to stress. When you're stressed, your body releases cortisol, the primary stress hormone. High cortisol levels can disrupt the balance of reproductive hormones like estrogen and progesterone, making period symptoms worse. Stress can also cause muscle tension, which increases cramping, and can lead to poor sleep, which further intensifies period discomfort. For some women, stress triggers a cycle that makes their periods even more painful. Chronic stress can disrupt ovulation, leading to hormonal imbalances that cause heavier, more painful periods. It can also increase inflammation in the body, making the pain sharper and more persistent. Women who experience high levels of stress are more likely to have irregular cycles, stronger PMS symptoms, and heightened sensitivity to cramps. Mental health conditions like anxiety and depression can also make period pain worse. Research has shown that women with anxiety disorders or depression often report more severe menstrual pain. This is partly because stress and depression lower the body's pain threshold, making discomfort feel more intense. When you're mentally exhausted or emotionally drained, your body perceives pain differently, amplifying what might otherwise be a manageable level of discomfort. The good news is that managing stress effectively can help reduce period pain. Relaxation techniques like deep breathing, meditation, and mindfulness exercises can lower cortisol levels and help the body relax. Practicing progressive muscle relaxation, where you tense and then release different muscle groups, can relieve built-up tension that worsens cramps. Engaging in activities that bring joy, whether it's listening to music, reading, or spending time with loved ones, can also improve mood and make menstrual pain feel less overwhelming. Regular physical activity is one of the best ways to manage both stress and period pain. Exercise releases endorphins, which are natural mood boosters and pain relievers. Even a short walk or gentle yoga session can help reduce stress and ease cramps. Getting enough sleep is equally important. Sleep helps regulate hormones and repair the body, but stress often leads to poor sleep quality. Prioritizing rest, maintaining a consistent sleep schedule, and avoiding stimulants like caffeine before bed can make a significant difference in how the body handles menstrual discomfort. Another powerful stress management tool is social support. Talking to friends, family, or a therapist about emotions and menstrual experiences can help reduce feelings of isolation. Many women feel pressured to push through their period pain without acknowledging how much it affects them. Allowing yourself to rest, ask for help, and express what you're feeling can reduce emotional strain and make the experience more manageable. Understanding the connection between stress and menstrual pain is an important step in taking control of your health. While physical treatments like pain relievers and heat therapy are helpful, addressing mental well-being is just as essential. When the mind is at ease, the body follows. In the next chapter, we will explain the influence of diet and nutrition on menstrual pain, looking at the foods that help ease discomfort and those that can make symptoms worse. Chapter 11. The impact of diet and nutrition on menstrual pain. Let food be thy medicine, and medicine be thy food. Hippocrates. What you eat has a profound effect on how your body functions, and menstrual pain is no exception. Many women don't realize that their diet can either ease or worsen their period symptoms. The foods consumed in the days leading up to and during menstruation can influence hormone balance, inflammation levels, and even the severity of cramps. While painkillers and heating pads may offer temporary relief, making long-term dietary changes can help regulate menstrual cycles and reduce discomfort naturally. A diet high in processed foods, sugar, and unhealthy fats can increase inflammation in the body, which in turn makes cramps more painful. Inflammatory foods, such as fried foods, refined carbohydrates, and excessive caffeine, contribute to higher levels of prostaglandins, compounds responsible for triggering the uterine contractions that cause menstrual pain. When prostaglandin levels are too high, cramps become more intense and prolonged. Reducing processed and highly refined foods can help keep these inflammatory compounds in check. On the other hand, anti-inflammatory foods can significantly reduce menstrual pain. Omega-3 fatty acids, found in foods like salmon, flax seeds, and walnuts, have been shown to lower inflammation and reduce the intensity of cramps. Leafy greens, such as spinach and kale, are rich in magnesium, which helps relax muscles and reduce pain. Foods high in antioxidants, such as berries, oranges, and dark chocolate, help combat oxidative stress and support hormone balance. Calcium and vitamin D are two essential nutrients that play a role in reducing PMS symptoms and menstrual pain. Calcium helps regulate muscle contractions, including those in the uterus, making it beneficial for preventing severe cramps. Dairy products, almonds, and fortified plant-based milk are excellent sources of calcium. Vitamin D, which aids in calcium absorption, can be obtained through sunlight exposure or foods like fatty fish and egg yolks. Many studies suggest that women with low vitamin D levels experience more severe menstrual symptoms, so ensuring adequate intake is crucial. Hydration is another key factor in managing period pain. Many women experience bloating and water retention during menstruation, which can make cramps feel worse. Drinking enough water throughout the day helps flush out excess sodium and prevent bloating. Herbal teas, such as ginger or peppermint tea, also have soothing effects on the digestive system and can relieve bloating and discomfort. Ginger in particular has been studied for its anti-inflammatory properties and ability to reduce period pain naturally. Caffeine and alcohol are two common dietary triggers that can make menstrual pain worse. Caffeine, found in coffee, energy drinks, and sodas, can constrict blood vessels and increase muscle tension, leading to more painful cramps. Cutting back on caffeine, especially in the days leading up to menstruation, can help reduce discomfort. Alcohol, on the other hand, can dehydrate the body and interfere with hormone balance, sometimes making period symptoms more intense. Limiting alcohol intake or opting for healthier alternatives like herbal teas or infused water can make a noticeable difference. Balancing blood sugar levels is also crucial for menstrual health. Consuming too much sugar or refined carbohydrates can cause blood sugar spikes and crashes, leading to mood swings, fatigue, and worsened period symptoms. Instead of relying on sugary snacks, choosing complex carbohydrates like whole grains, beans, and vegetables can help stabilize energy levels and support hormone function. Protein-rich foods such as eggs, lentils, and lean meats also play a role in keeping blood sugar stable and reducing cravings. Incorporating mindful eating habits can further support menstrual health. Eating smaller, nutrient-dense meals throughout the day instead of large, heavy meals can prevent digestive discomfort and bloating. Listening to hunger cues, avoiding overeating, and choosing foods that nourish the body rather than just satisfying cravings can improve overall well-being. Diet alone may not completely eliminate menstrual pain, but making smart food choices can significantly reduce symptoms and support a smoother cycle. Small changes, such as increasing omega-3 intake, staying hydrated, and avoiding processed foods, can lead to noticeable improvements over time. When the body is nourished properly, it functions more efficiently, leading to a more balanced and pain-free menstrual experience. In the next chapter, we will explain natural and medical approaches to managing menstrual pain, from herbal remedies to modern treatments that provide relief. Chapter 12. Natural and medical approaches to managing menstrual pain. The natural healing force within each of us is the greatest force in getting well. Hippocrates. For many women, menstrual pain feels like an unavoidable part of life. Every month, cramps, headaches, fatigue, and discomfort become an unwelcome routine. Some rely on over-the-counter painkillers, while others endure the pain in silence, unsure of what else they can do. The good news is that period pain isn't something that has to be accepted as a normal part of life. A combination of natural remedies and medical treatments can offer real relief and help women take control of their menstrual health. Natural remedies have been used for centuries to ease menstrual discomfort. Herbal medicine is one of the most effective natural approaches. Ginger, for example, has powerful anti-inflammatory properties and has been shown to reduce period pain just as effectively as some painkillers. Drinking ginger tea or taking ginger supplements in the days leading up to and during menstruation can help reduce cramping and inflammation. Similarly, cinnamon has been found to ease cramps and heavy bleeding due to its muscle-relaxing properties. A simple cinnamon tea or adding cinnamon to meals can make a difference. Magnesium is another essential mineral that plays a key role in muscle relaxation. Women who experience severe cramps may have low magnesium levels, which can make uterine contractions more painful. Eating magnesium-rich foods like nuts, seeds, dark chocolate, and leafy greens can help. And for those who need extra support, magnesium supplements may be beneficial. Some women also find relief from taking vitamin B6, which helps regulate hormone balance and reduce PMS symptoms. Heat therapy is one of the simplest and most effective ways to manage menstrual pain. A heating pad, hot water bottle, or warm bath can help relax the muscles in the lower abdomen and increase blood flow, reducing cramping. Studies have shown that heat therapy can be as effective as pain medications in easing menstrual pain. Applying heat to the lower abdomen for 15 to 20 minutes at a time can provide quick relief. Acupuncture and acupressure have also gained attention as natural pain relief methods. Acupuncture, a traditional Chinese medicine practice, involves inserting thin needles into specific points of the body to stimulate blood flow and reduce inflammation. Some studies suggest that acupuncture can help balance hormones and relieve menstrual pain. Acupressure, which involves applying pressure to certain points on the body, can also be done at home. One commonly used pressure point for menstrual pain is located a few finger widths below the navel. Applying firm but gentle pressure to this area for a few minutes can help ease cramps. For women who experience extreme pain that disrupts their daily lives, medical treatments may be necessary. Over-the-counter pain relievers like ibuprofen and naproxen work by reducing prostaglandins, the compounds responsible for uterine contractions. These medications are most effective when taken at the first sign of discomfort. However, long-term use can have side effects, so it's important to use them cautiously and under a doctor's guidance. For women with severe period pain caused by conditions like endometriosis or fibroids, hormonal birth control methods can be a game-changer. Birth control pills, patches, and intrauterine devices, IUDs, can regulate the menstrual cycle and reduce cramping by thinning the uterine lining and preventing ovulation. While hormonal treatments can be highly effective, they are not suitable for everyone, and discussing the benefits and risks with a healthcare provider is essential. Lifestyle changes can also make a significant impact on menstrual health. Regular physical activity, even light exercises like yoga and walking, can help improve blood circulation and reduce inflammation. Managing stress through meditation, deep breathing, and relaxation techniques can also reduce period pain, as stress can increase muscle tension and worsen cramps. Prioritizing sleep and getting enough rest during menstruation can further support the body's ability to heal and recover. Finding the right combination of natural and medical treatments is key to managing menstrual pain. What works for one person may not work for another, so it's important to explore different approaches and listen to the body's signals. Keeping a menstrual pain journal to track symptoms, diet, and lifestyle habits can help identify patterns and determine the most effective strategies for relief. Menstrual pain is not something women should have to endure in silence. With the right knowledge and tools, managing period pain can become easier, leading to a healthier and more comfortable menstrual cycle. In the final chapter, we will summarize everything covered in this book and discuss how women can take a proactive approach to their menstrual health. Conclusion: taking control of menstrual health. Your body hears everything your mind says. Speak to it with kindness. Unknown, menstrual pain has been a silent struggle for many women, passed down through generations as something that must simply be endured. For far too long, it has been dismissed as just part of being a woman. But understanding the causes of menstrual pain and exploring the many ways to manage it can change the narrative. Period pain is not just an inconvenience, it is a signal from the body that something needs attention. And the good news is, there are solutions. Throughout this book, we have discussed the science behind menstrual pain, the different types of cramps, and the underlying conditions that make periods more painful for some women. We have looked at how diet, lifestyle, hormones, and even stress contribute to menstrual discomfort. We have also examined various strategies, both natural and medical, that can help alleviate pain, from simple home remedies like heat therapy and herbal supplements to medical interventions like hormonal treatments and pain relievers. One of the most important takeaways is that every woman's body is different. What works for one person may not work for another. Some may find relief through dietary changes and supplements, while others may need medical treatment to address underlying conditions like endometriosis or fibroids. Tracking menstrual cycles, paying attention to symptoms, and experimenting with different remedies can help each woman discover what works best for her. It's also essential to break the stigma surrounding menstrual pain. Too often, women feel pressured to push through the discomfort, even when the pain is severe enough to disrupt daily life. Talking openly about menstrual health, seeking medical advice when needed, and advocating for better research and healthcare options are all important steps toward improving how menstrual pain is understood and treated. Taking control of menstrual health is not just about finding ways to relieve pain, it's about understanding and respecting the body. It's about making informed choices, embracing self-care, and recognizing that period pain should never be ignored or normalized when it affects quality of life. No woman should have to suffer in silence. By combining knowledge, self-care, and the right treatment options, managing menstrual pain can become easier, leading to a healthier, happier life. This is not the end of the conversation, it's the beginning of a new way of approaching menstrual health. If this book has helped in any way, share what you have learned with others. The more we talk about menstrual pain, the closer we get to real solutions for everyone. You are not alone, your pain is real, and there is hope. You've just completed End of Cramps, a complete guide to managing menstrual pain, and we at MedSpirit truly thank you for taking this journey with us. We hope the knowledge you've gained helps you or someone you care about live with more ease, awareness, and empowerment. If this book helped you, don't keep it to yourself. Share it, talk about it, and help others break the silence around menstrual pain. Until next time, keep listening, keep learning, and keep healing. Stay strong, stay informed, stay spirited with MedSpirit.